In this lesson, we are going to talk about the bones of the head. This is applicable to both the lecture and the lab. A lot of overlap in this section of the class, just like in the last section. These two YouTube video links are other perspectives on taking the skull and looking at all of the different features, not from me, but from other professors. So hopefully they're good as a supplement for you. The skull is composed of cranial bones as well as facial bones. The cranial bones are essentially making up the brain case, right? So in the beginning of the semester, we talked about the cranial region. And so the cranial region is, the flat bones of the skull. They are making up this bony encasing around the brain, as opposed to the facial bones, which are making up the face itself. When we look at this list, note that some of these words or some of these bones have the number 2 after them. Essentially what that means is that some of these bones are paired. So there are 2 parietal bones, there are 2 temporal bones, but there's only 1 frontal and 1 occipital bone. Okay, so for the most part, I'll show you just one of these bones, but keep in mind that a lot of them, there are 2 of them. Okay. I also want to point out that there is the hyoid bone. So sometimes in different texts and different internet sources, different professors even might say 14 facial bones instead of 15 facial bones. And the reason for that is that the hyoid bone doesn't really fit in anywhere. It is the only bone in the body that does not directly articulate with any other bone. It is part of the larynx, so part of your voice box, and it's really important in essentially maintaining this open airway into your lungs and assisting with the swallowing reflex and kind of a point of leverage for closing over the opening into your lungs when you swallow, etc. And so it's just kind of like floating down here under your jaw. Not actually attached to any other bones. And so it is the closest to the face, and therefore I and other instructors group the hyoid bone together with the facial bones, right? But then I just wanted to throw it out there that sometimes you'll see the number of bones differ a little bit. Another thing I want to point out is that you have probably heard that there are 206 bones of the body, but this is actually kind of like the most common number. It is possible, right, and actually fairly common for extra tiny little bones to exist kind of in between the flat bones of your cranium, right? And so instead of just having, these big frontal, temporal, parietal bones, you also have these other smaller bones, and I think we'll see some of that in this presentation as well. All right, so 206 is the accepted number, but keep in mind that everybody is different, and this number does vary more than you might expect. I'm going to draw on the screen here and identify some of these features, and I encourage you to do the same. Okay. What we can see here is the skull from the anterior, the lateral, the superior, and so the nose would be over here, so looking straight ahead there, and this is the posterior side of the head. I want to start off with identifying the joints between the long bones. Okay, so in the last section of this class, we talked about articulations, we talked about the fibrous joints and how a lot of these fibrous joints don't move at all. And so one of the main examples of those fibrous joints were sutures. Okay, so let's take a look at some sutures here. The joint in between this blue bone and the yellow bone, right here, which we are going to learn soon, is the frontal bone and the parietal bone. This is called the coronal suture. Okay. So if you remember from the very beginning of class, a frontal section is also called a coronal section or a coronal plane. And so this coronal suture is actually the coronal suture is essentially following the coronal plane. Sorry, 1 second. There we go. So the coronal suture, the sagittal suture, right? It's kind of a similar idea. Sagittal is a word that we have heard before as well, and it essentially means like right down the middle. So we have a sagittal plane, a sagittal section, and so the joint that connects two bones kind of like right down the middle here, this is called the sagittal suture. Note that there's one G and two T's. I see this get mixed up all the time. So one G, two T's. And actually the way that I remember this is, it's a little difficult to draw here, but if anyone has watched Avatar, which is suddenly popular again, which is exciting, Avatar, the last airbender, right? He has a big arrow right here, right? And essentially the arrow is following the sagittal suture. And so the two T's kind of form this arrow in the middle of sagittal. Yay! I'm glad to hear that. Oh my goodness. I appreciate when you guys understand my references. It makes me feel not so old. All right, next. The word squamous or squamous we heard when we talked about tissues, right? So squamous or squamous means like flat. And so this this joint here that is on the flat part of our skull, so on the lateral part over here, is called the squamous or squamous, depending on if you if you're a veterinarian or study human anatomy. There's a lot of different pronunciations, but anyway, squamous or squamous suture is on the lateral, the flat sides of your skull. Okay. Finally, if we look at the posterior side of the skull, we see that there is a suture, there's a big joint here between the two parietal bones on the side of your skull, as well as the occipital in the back. Again, I'm going to add in these bone names here soon. But if we look at the green and the blue together, essentially it is making this kind of a shape. And if anyone is in the Greek community on campus, you might know that this looks like the Greek letter lambda. All right, so that is the Greek letter lambda, which is roughly the shape of the sutures on the back of the skull. So we call this the lambdoid suture. So between the occipital and the parietal bones. Any questions about those? All right. Quite a while ago in this class, we talked about the formation of the bones. We talked about endochondral ossification, we talked about appositional bone growth, and we talked about intramembranous ossification. I told you that intramembranous ossification, of course, continues even after you are born. And in between these bony plates that are forming, there's actually still membrane that is essentially where the bones are continuing to grow and make the skull a lot larger. These membranous portions of an infant's skull have a particular name, and that name is fontanelle. And sometimes you'll see this in its feminine form. They both mean the same. So this essentially is the fontanelle, the soft spot of the baby. And so now we can see that these are essentially where the suture joints are forming. So this one here will be the sagittal suture, this will be the lambdoid suture, this will be the coronal suture. And until the skull is done forming, the membranes are essentially those joints, right? Those suture joints. Okay, so those are called fontanelles, and this is the main fontanelle, the main soft spot that we know about. But of course, there are these membranous squishy places elsewhere in the skull as well. All right, oops. Let me make that bigger. Some of this is still residual from when I would actually like teach in person, so a little smaller here. Okay, so here is the frontal skull. Let's annotate this. So this big bone in the front is called the frontal bone. There's only one frontal bone. It is not paired. Some features of the frontal bone that are important for us. Note that the frontal bone forms the superior aspect of the orbit or the eye socket. Okay, so this here is the superior ridge of the eye socket, and we can call this the supra above orbital above the eye socket margin, which is just kind of like a smooth portion of the bone. And so supraorbital margin. What we can also see is that just superior to the supraorbital margin is a hole. And there are actually going to be quite a few holes for which you are going to be responsible for learning. In general, think about the fact that your brain, of course, is on the inside of your skull, but it has to control the muscles and the skin on the outside of your skull. So the skin and the muscles are on the surface. And so we need to have nerves and also blood vessels, right, which are routed from your heart up through your skull and then pass back out of your skull to innervate and feed your face. Okay, so we're going to see a lot of different holes. For the most part, these are just routes for nerves, blood vessels, and lymphatic vessels to pass from inside your skull to outside your skull, or vice versa. Okay. So this particular hole, again, is above the orbit, above the eye socket, so we can call it supra orbital, and it's a hole, and we know that we have a specific word for hole, foramen, okay, or foramina for plural, supraorbital foramen. And last one here is actually something I just saw like on some like silly meme the other day, but the region of your frontal bone in between the orbits has a special name as well, and this is called the glabella. Okay. Any questions about the frontal bone? All right, next, we can see that there is a pair of bones that makes up essentially the bridge of your nose, right? So this is where your glasses would be sitting. Okay, there are two of them, so a pair, and these are called collectively your nasal bones. Okay. Of course, most of your nose is made up of cartilage, okay, so cartilage, muscle, etc. But the bridge of your nose is actually part of your skull. It's actually bony. Okay. If we look inside the eye socket, we can see these green bones here. Okay, so both of these are called the lacrimal bones. So the lacrimal bone, and lacrimal essentially indicates that this has something to do with making tears. And so essentially, our tear glands are way up here underneath our eyebrows. Okay, and what they do is they constantly produce tears. The tears bathe over the surface of our eyes, right? And as long as we're making, few enough tears, essentially these tears actually drain through a hole in the bone right by the medial canthus, right? So right by the inner corner of your eye, and they drain into your nasal cavity, right? So essentially when you are, not emotional or not, having an allergic reaction, or there isn't something in your eye or something, you make few enough tears that they can just drain into your nose and then back down your pharynx into your digestive tract. Of course, when you have something in your eye, you want to flush out that something from your eye. When you are emotional, right, sad, happy, whatever, you can make more tears as well. And essentially, yes, tears are still draining down through your nose, which is why your nose runs as you are crying, but also essentially the capacity of these little canals through the lacrimal bones is exceeded and the tears come out the front of your face instead. Okay. Let's see. If we look at the back of our orbit, the back of our eye socket, we see this orange bone. Now, this is a bone that we're going to see in a couple different perspectives. This is the same as this bone, and also this bone branches all the way out to make up part of your temple. Okay, so it's all one single bone. Now we're going to see this again, but just so that you can begin to get a perspective of this now, this is called the sphenoid bone. Okay, so this kind of acts as the cornerstone of your skull. Almost all of the bones of your skull are going to articulate with the sphenoid bone. All right. Next, rounding out the rest of the orbit here, okay, another pair of bones. This one is called the Zygomatic Bone. It's a pair, there are two of them. Essentially, this makes up the pointy part of your cheeks right under your eyes. And if you feel that that cheekbone that you would like highlight with makeup or whatever, that goes all the way back to your ear pretty much, most of that is your zygomatic bone as well. All right, most. We're getting there. Okay. Next. This big purple bone. Okay, so we can see it's making up part of the orbit. We can see that it's also making up the upper jaw as well. Okay, this is called the Maxilla Bone. You might also see it referred to as maxillae, so with an E at the end indicating plural. The idea here is that this is actually two different bones that fuse together right here in the middle over the course of your development, right? So it starts out as two and then it fuses together to be one. Okay, so you can see this word referred to as just a single maxilla or two maxillae. Okay. Within the maxilla bone, we have a couple holes. Again, these are always for the passage of blood vessels and nerves to the face. And so this hole isn't above the orbit. Instead, it is underneath or inferior to the orbit. It is also a hole though, so infraorbital foramen. And of course, there are two of them. Right. If we look inside the nasal cavity, what we can see is a green bone. Right, this is another one of those bones that we are going to see from another perspective. It's a little bit wild to see right now, but let me just point out that this entire thing is called the ethmoid bone. And we're going to see that from a different perspective, but essentially this makes up the roof of your nasal cavity. There are some funny things kind of sticking into your nasal cavity from the sides, the nasal conchae, which you might remember from the special senses talk. And it also makes up half of what is called the nasal septum, so the wall or septum that divides your nasal cavity into right and left halves. Okay. So this portion here is making up the superior aspect. The inferior part of the nasal septum is made up by a different bone. Right, so this blue bone right here, separate bone, this is called the vomer, and there's only one vomer bone. All right, finally, we can see that there are a pair of bones here. These are called your inferior nasal conchae. Okay, so they're the most inferior kind of swirly bones sticking into your nasal cavity from the lateral sides. And so those are their own bones. The other two nasal conchae are part of the ethmoid bone. Again, we're going to see that. Moving down to the movable part of our jaw, so our inferior jaw. This entire bone here is the mandible. Within the mandible, we have a couple holes. Right? These holes are in the chin region. Right? So remember from the very beginning of class, we talked about the thinker, the statue who's sitting there, like having lots of mental stuff going on in his head while he's holding his chin. So the chin is the mental region. So we call these the mental foramina, or foramen for singular. Okay. Keep in mind that there are a couple more holes on the mandible, but they are on the medial side. Right, so on the inside of the jaw, and those are going to be called the mandibular foramina. So they are holes in the mandible, but the ones in the chin are called the chin holes. All right, one more structure that we can see here, and then we'll switch perspectives. Essentially the tooth sockets, right? The socket of the gomphosis joints, again from last exam. These are called the alveolar margins. Yeah, so they're going to be part of the maxilla and part of the mandible, and this is where your teeth are going to sit. Yeah, so that's a great question. Specifying right or left, you should definitely be prepared to talk about right and left on the practical exam. Right, so try to be as specific as you can possibly be, right? There's there's a left zygomatic bone, there's a right zygomatic bone, but there's one frontal bone. Good question. Anything else I should clarify while we're here? All right. So moving to the lateral perspective, and what do we already know? Well, this entire blue bone right here is the frontal bone. We can see the one of two nasal bones. We can see the maxilla. We can see the mandible. The zygomatic bone. Here we can see a much better perspective of the lacrimal bone. And note that there is this little indentation here. That is actually where your tears are going to drain down into your nasal cavity. We can see the sphenoid bone. So I think that's what we know so far. Let's add some terms. Okay, this big yellow bone here is called the parietal bone. Okay, there are two of them, and remember that these are going to articulate with one another in the middle at that sagittal suture. Okay. The pink bone is called the temporal bone. And finally, all the way to the posterior side, we have the occipital bone. And so in our next class, when you guys are going to be learning about the different lobes of the cerebrum, keep these bones in mind, right? You have one lobe of the cerebrum that is right here. That's your frontal lobe. Two on the sides, right? So those are going to be your parietal bones, temporal or parietal lobes, Your temporal lobes are going to be right behind your ears, and your occipital lobe, which processes your visual information, is all the way to the back. Okay, so by learning the bone names, you should also be learning the brain terms. Okay. Let's add in some structures or some features on these bones. All right, first of all, in the temporal bone, we see this really big thing that's sticking out right here. Now, on your skull, if you feel right behind your ears, right, it's right where your skull stops and your neck starts, there is this big bump. That is this bump. Okay, so this is called the mastoid process. Okay, and in a future class, we are going to learn about the sternocleidomastoid, which is a muscle that is essentially diagonal right here, and that is going to insert on the mastoid process. So mastoid process essentially is allowing us to move our head side to side and look straight up. Okay. So the mastoid process is pretty much right behind our ears. We can see where the ear is on the skull because there's a big hole. Okay. This hole is called the external, meaning there's probably going to be an internal, okay, acoustic, sometimes called auditory, but we're going with acoustic. And yes, it's a hole, but it's more of like a canal. In fact, in layman's terms, we call this the ear canal. In more technical anatomical terms, we call this the external acoustic meatus, right? It looks like meatus, but meatus. Okay, so that's essentially your ear canal. Finally, we have a little pointy thing sticking off right underneath our ear. And so essentially this is where some of the muscles of your tongue are going to attach to give you some leverage to move your tongue all over the place and talk and chew, etc. So this one here is particularly pointy, right? If I were to describe it, I'd say it looks kind of like a stiletto, right? So very, very pointy. This is in fact also called a styloid process, right? And I say also because we've seen the term styloid process before. Remember that we have a styloid process in the radius, we have a styloid process in the ulna. Right, so this is the third and final styloid process that we are going to see. And this one I think looks the most like a stiletto out of all of them. Next, we can see that this structure here is essentially sticking out from the temporal bone. And in fact, it's a little hard to see because this is two-dimensional, but there is a gap in between your temporal bone and your sphenoid bone and this part of the temporal bone. So this makes up the other part of that ridge of your cheek right here. Okay. So there's that part, and this part of the zygomatic bone, right? Both of these little extensions of bone are processing towards one another, making up your cheekbone. Okay. So I point that out because this portion is called the zygomatic process, right? Because this is a piece of the temporal bone that is processing towards the zygomatic bone. Okay. This part of the zygomatic bone is processing towards the temporal bone. Oops, it's processing towards the temporal bone, so we call it the temporal process. Okay, so the temporal process of the zygomatic bone and the zygomatic process of the temporal bone articulate together to form the full cheekbone. So I know that that sounds a little bit confusing, but it makes sense, right? part of the temporal bone is processing towards the zygomatic, so we call it the zygomatic process, and vice versa in the other direction. Furthermore, both of these together, so the cheekbone itself, collectively, both of these things, is called the zygomatic arch. Okay, so on a lecture exam or on a lab practical, I could ask you for just this, like what is this specific structure only here? What is this specific structure only here? Or what is this entire structure, the entire cheekbone? Okay. One is the zygomatic process, the other is the temporal process. Together, they are the zygomatic arch. Okay, so replay the video if you need to hear that again. Final structure of the temporal bone that we can see from this perspective anyway, and that is essentially the temporal part of your TMJ. Your what? Right, so the socket, right, the curved, the condyle, smooth articular surface of the temporal bone, with or into which part of the mandible is going to articulate. This is the only joint in the skull that is actually freely movable. It is a ball and socket joint. There are little bursae within there so that we can freely move our jaw to talk, to chew, etc. Okay, so the temporal portion of the TMJ, the temporal mandibular joint, TMJ, is sorry, goodness. It's called the mandibular, right? Suspense, right? Fossa. I remember a fossa is an indentation on a bone. So this is an indentation on the bone into which the mandible is going to articulate. All right, now which specific part of the mandible? We can see that there is a little extension, a little protrusion of the mandible that forms the mandibular portion of the TMJ, temporomandibular joint. And so this one is going to be called, well, it's part of the mandible, so mandibular, and it's a smooth articular surface, so condyle. A mandibular condyle. Now we can see there's also some other stuff going on over here in the mandible, so let's talk about that for just a moment. This right here is an attachment site for some muscles that help you to chomp down really hard, close your mouth, take a bite out of an apple. And so this here, sorry, I just want to make sure I get this right because this is another one that is a little bit tricky. So this is another, the final coronoid process. And now you can see why I was checking. So coronoid as opposed to coracoid, right? So we had one coronoid process in our ulna. We have a coracoid process in our shoulder, right, our scapula. And now we have the final coronoid process in our mandible, in our jaw. Okay. So that is that. Final feature that we can see from this perspective. In between the mandibular condyle and the coronoid process, we have a little V shape. Now we've seen a V shape part of a bone before in our greater sciatic notch, right in the back of our ascoccyx. This V-shaped indentation is also going to be a notch, but it's not for our greater sciatic nerve or our sciatic nerve. Instead, it's part of the mandible, so we'll call it the mandibular V-shaped indentation notch. Okay. Any questions about any of those structures, bones, etc.? All right. So just a little bit of a different perspective on the temporal bone. So I just want to point out the zygomatic process really is sticking out away from the temporal bone. Okay, so hopefully in the lab videos, you'll be able to see that like stuff passes in between this zygomatic arch really and the temporal bone and sphenoid bone behind. Also want to point out that this here is the mandibular fossa. Yes, it is part of the temporal bone, but it is for articulation with the mandible, right? This portion of the mandible is a condyle, a smooth articular surface, right? So it's part of the mandible, mandibular, smooth articular surface is a condyle. Okay, and again, the coronoid process, this is for muscles to attach to essentially pull your jawbone, your mandible up and help you to chomp down. Okay, so now we are looking at the posterior side of the skull. Okay, what do we already know? Well, we already know that this is is the left parietal bone. This is the right parietal bone. In the middle, we have the sagittal suture. Right. These here are the lambdoid sutures. Lambdoid sutures. Also, while we're here, I want to point out, like I was talking about before, that there can be some other little bones, particularly in the skull, that form just because of, variability in intramembranous ossification. But this is why we have, approximately 206 bones. Right. This right here, this happens to be the mastoid process. Remember, that's part of the temporal bone. And so this entire bone here is the occipital bone. And there's only one of them. Okay. As we can see, there are a couple features of the occipital bone that we are going to be learning about. First of all, and probably most easy to recognize on the skull, there is a hole right here that is surrounded by two little bumps. All right, the hole is a hole, so we'll call it foramen. And as we're going to see from another perspective soon, it's huge. Right? And the reason it's so big, it is magnum, very large, is because this is where your spinal cord exits your skull and starts to travel down your vertebral canal. Okay, so that is where your spinal cord exits. This is where the brain stops being the brain and starts being the spinal cord. It passes through this very large hole. Okay. Now on either side, we see these little bumps. Okay, so these these little bumps are part of the occipital bones. And they are smooth articular surfaces, so we'll call them condyles. Right, so why would we need condyles here? Well, these smooth articular surfaces are what are going to articulate with atlas, right? So C1, the first vertebra of your spine, this is where your head is sitting on your spine. And so of course we need very smooth surfaces so we can say yes, right, at that particular joint. So two occipital condyles, very smooth, flanking either side of the foramen magnum. All right, next, we have two ridges on the posterior side of our skull, so on the occipital bone. These ridges are essentially for the attachment of different muscles. So part of the erector spinae are going to attach right here. And so they are going to help us pull our head up as well as straighten our spine. Okay. We should recognize part of this term already, right? And the part that we should recognize is nuchal. Right? Remember, the very first day of class together, we talked about the nuchal region, so the back of the neck. These are in the nuchal region, so we call them nuchal something. Okay. There are two of these nuchal lines. This first one is superior, and the inferior one, conveniently enough, we call the inferior nuchal line. Okay, superior nuchal line, inferior nuchal line. But wait, there's more. We can see that in the middle of the superior nuchal line, there's kind of a little triangle here. And so this triangle is usually a little bit more prominent on males than females, but essentially it would be right back here, like right under my ponytail, the base of your skull. This is called the external occipital, one of my favorite anatomy words, protuberance. External occipital protuberance, and it really does protrude quite far, again, particularly in males. Finally, there is a line on the posterior side of the skull that's essentially connecting the inferior nuchal line with the foramen magnum. All right, this is called the external occipital crest. Okay. Keep in mind that if you are looking at like lab skulls, which are actually cast of real skulls, these lines and features on the occipital bone are not as clearly defined as you can see in this diagram. So this is kind of an ideal picture here. For the most part, the superior nuchal line is much more prominent than the inferior nuchal line. And the external occipital protuberance is what's going to give away the fact that you're looking at the superior nuchal line, big triangle right in the middle, and then maybe a faint little inferior nuchal line, and then usually the external occipital crest is a little bit more prominent than the inferior nuchal line as well. All right, so we know it's there, right? Squint your eyes, use your imagination to find these nuchal lines on the back of the skull. Questions? Moving along then. Okay. The sphenoid bone. As I said before, the sphenoid bone acts as kind of the cornerstone of most of the skull. All of, or almost all of the cranial bones, almost all of the facial bones are going to articulate with the sphenoid bone. It spans the temple, or from one temple to the next temple. Okay, so right behind your eyes, lots of different processes, lots of different holes, so pretty complex bone, okay, which is why we're going to look at it in isolation here. This is also something you should be prepared to look at in isolation or articulated within the skull on the lab practical. Okay, but you'll be introduced to that soon. Okay. So the sphenoid bone sits behind the frontal bone. Right, so this is where the nose would be. You'd be looking straight out to the front here. Anterior, posterior, we're looking down into the skull. Sphenoid bone extends from temple to temple. Okay, and we can see here it's articulating with the frontal bone, with the temporal bones, right, and up here even with the parietal bones. If we were to remove the sphenoid bone in the same orientation. So looking down, like if we take off the top of our skull, look down into the skull, and then take that sphenoid bone out. That is what this perspective is right here. Okay. These portions over here are what are in your temples. Okay. These are called the greater wings. Okay. Greater implies there's going to be a lesser. If we look at the sphenoid bone from the back, or from the posterior side, we can see that still there are these big wings all the way out to the lateral side, the greater wings. If there is a greater, there must also be a lesser. These little guys up here, so a little bit more superior as well as medial. Okay. Looking down on the sphenoid bone, these are what we're talking about. The lesser wings. Okay. Now, all of these wings, greater wings and lesser wings, are connected to kind of a chunky portion of the bone. All right, so lots of different things sticking off, but they all kind of join together in the middle here. And this middle is conveniently called the body. All right, so the wings are attached to the body of the sphenoid bone. Sticking down. All right, so again, we are looking at the sphenoid from the posterior side here. More or less, this is the opening to your pharynx, the opening to the throat in the back of your nasal cavity. Okay, and on either side, we have these little things that stick straight down. These are also attachment sites for different muscles. These particular muscles help you to protrude your jaw, so stick it straight out to the front or go side to side. Right? All of that is by attachment to these processes right here. Yes, and if you think that looks silly, just wait to learn about the facial muscles. Mel makes a fool of herself, but it'll be fun, don't worry. These are called the pterygoid processes. Okay. So pterygoid, what the heck? Some early anatomists thought that these reminded them of a pterodactyl, so flying dinosaur, and so these are called the pterygoid processes. All right. Next, when we look straight down on the sphenoid bone, we can see that there is a little cup shape right here. Okay, this cup shape is actually where your pituitary gland is going to sit. Right, so for some perspective, this is just over the roof of your mouth. And so your pituitary gland is the connection between your nervous system and your endocrine system. Together, they control the entire body. And where that is sitting is literally right over the roof of your mouth in this little cup shape like saddle. Okay. And so what do we call this? Two different names, and there is a minor distinction between the two that we are not going to make in this class. The sella turcica literally means the Turkish saddle, or the hypophyseal. The hypophysis is the pituitary gland, and it is an indentation in the bone, so hypophyseal fossa. Okay. For our purposes, you can tell me either one, and that is okay. There are also three, actually, there's 1, 2, 3, 4 holes within this bone that we are going to learn about here in just a moment, right? So I'm going to show you in the entire skull as opposed to isolated on the sphenoid bone. Okay. Any questions about that? Right, moving right along then. The Athemoid bone, another one of these really weirdly shaped bones that's really important to understand because it is also kind of right in the middle and articulating with lots of different things. It helps to make up our brain case. It helps to make up our nasal cavity. It helps to make up our orbits. Right? So really involved in a lot, even though when you look at it in isolation, it really just looks like this like chunky little block of bone. Okay. So where is the Ethmoid bone? We saw it, well, there's a little bit in our orbit. I pointed it out to you right here, right, making up our nasal cavity, right? We can see it here in red as well. Okay. If we were to remove the ethmoid bone right out of the front of the skull, this is the perspective we would see. Okay, so essentially your, let's see, your eyes would be right here. Okay. On either side. And so this is the top of your nasal cavity. Okay. This is your brain case, right? Your cranial vaults. Okay, so here is where your brain is. Note that your brain, right, here is one hemisphere, here is another hemisphere. We want to make sure that when we do jumping jacks, our brain isn't like sloshing around in our cranial vault. We want to make sure that it is secured to our skull so that we don't give ourselves a concussion every time we do jumping jacks. And so there's one point on the skull that actually attaches the brain. So all of the meninges, right, the connective tissue around your central nervous system is going to connect to one little spot. And that spot is this projection from the ethmoid bone. Okay. This is called the crista galli, which literally means the Cox Comb. And so if you don't have chickens, hopefully you can imagine anyway that a lot of chickens, not all of them, have that little like red squishy thing on the top of their head. So that's called a comb. And so this here is the Cox Comb, right? So essentially our little red thing sticking straight up, which of course is what actually allows our brain to attach to our skull. So that is the crista galli. And we're going to look at that from another perspective as well. On either side of the crista galli is a little flat portion of bone making up the roof of your nasal cavity. And I saw in the Kahoot that this question was one of the difficult questions, one of the questions that a lot of students got wrong, and that's okay. Kahoot said puzzles and everything are always graded for completion, not accuracy. And also today you'll get a little bit more perspective than you had before. This roof of the nasal cavity, right, the right and the left nasal cavity, is this right here. Okay. We call the bony part, right, the actual part of the bone, the cribriform plate. Right. Note that cribriform has 3 R's in it. I see students leave out 1 or 2 of these R's all the time, but cribriform plate. Okay, so that's the solid part. That's the piece of the bone. And through the cribriform plate, we have holes. Right. So these holes are where the olfactory neurons are going to pass from our nasal cavity up to our olfactory bulb, relay this information into our brain about what things we are actually smelling. And so the holes within the bone are called the, go figure, olfactory foramina, or olfactory foramen for singular. Right, so if we look really closely here, we can see that there are little holes through the cribriform plate of the ethmoid bone. Okay, so this portion right here would be your olfactory epithelium. All right, those neurons bind to different odorant molecules. Right, they generate an action potential. The action potential travels up the olfactory neurons into the olfactory bulb, and then the information is relayed into your brain. So hopefully that sounds a little bit familiar. For a little bit more perspective here, this is where your olfactory epithelium would be. And so your olfactory neurons would pass through the olfactory foramina into the olfactory bulb, right? When in doubt, tell me olfactory, because it's probably halfway right. Everything is olfactory right around there. All right, a couple more structures on this bone. It looks really small and confusing, but a lot is going on with this. We can see protruding from the lateral walls of the nasal cavity medially are these little bumps. These particular bumps are called the superior nasal conchae. And these little bumps are called the middle nasal conchae. Middle and superior, which I just drew over. So when we look at the half head here, we can see the superior, middle, and I told you about this before. There is another little bone, pair of bones that stick out, and that is the inferior nasal conchae. Final structure on the ethmoid bone. As I said before, the ethmoid bone, together with the vomer, makes up the nasal septum, so the wall dividing your nasal cavity in half. This makes up the superior part of your nasal septum, and it is called the perpendicular plate. Questions? So looking down into the skull, and I recognize that I am running out of time here, so I'm going to speed it up just a teeny bit. This bone is your ethmoid bone. In the middle here, this is your crista galli. So in the middle is the crista galli of the ethmoid bone. Okay. On either side, which is what these, or what the line is referring to, this is the cribriform plate, which of course has within it the olfactory foramina. Okay. We have the frontal bone. Temporal bone. The yellow is the parietal bone. Orange is sphenoid bone. And within the sphenoid bone, we have the lesser wings, greater wings, sella turcica, which is what the arrow is pointing to, or hypophyseal fossa. Okay. And way back here, we have the occipital bone. This line is pointing to the foramen magnum. Okay, so really a large hole, especially if you think about the other holes that we're about to talk about, which are much, much smaller. Okay. So from this perspective is also a great place to see a lot of the holes of the skull. And so you will be responsible for learning a lot of these holes for both the lecture and the lab. For the lab, it's simply, you know, what is this hole called? And you'll tell me the foramen magnum. For the lecture, you should also know what is passing through the holes that I identify for you. For the most part, what is passing through these holes that we can see from this perspective are the cranial nerves. And so this is also relevant to our lecture content. I will ask you to know what is the name of the hole, what is passing through the hole, and what is the function of that thing that's passing through the hole. For the most part, it's all cranial nerves. So that is where we are going on the next slide. Okay. All right, so try to go over these in relative order. All right, these holes, we already know the name of them. The holes themselves, right? So I'm essentially going to be making a little chart here. In the first column, I will tell you foramen name. Right? What is the name of the hole? What is the cranial nerve that is passing through the hole? Okay. And what is the function of this particular cranial nerve? Okay, so that is kind of the format I'm going to give you guys. All right. First, all right, we already know the foramen name, the olfactory foramina. Okay. What cranial nerve passes through? Well, cranial nerve number 1. Keep in mind that cranial nerves are always referred to as Roman numerals. Okay, so cranial nerve 1, so just plain old I, which is called the olfactory. What is the function of this cranial nerve? Well, this is part of the special senses. It is a special sense, specifically olfaction, right? The sense of smell. Okay. So that is the extent of content that I would need you guys to know for the lecture in particular. Okay. There is a lot more information we could talk about with the cranial nerves. Like you could talk about just sensory, just motor, or mixed. We can talk about whether it's part autonomic or part just somatic, or et cetera, et cetera. But for our purposes, this is the content that you should learn. Okay. Next, just under the lesser wings is another hole. All right, keep in mind that the eyes would be essentially here, okay, and sticking out the back of the eye. Now, you know, after you've watched a special senses lesson, the optic nerve sticks out in this direction, and so it's essentially going to cross over to the opposite side of the brain, right here next to the sella turcica. Okay, so it has to pass from the orbit on the outside of the skull into the skull. And so this hole is how it does that. Okay. So what is the name of the hole? The name of the hole is called the optic canal. Okay. What cranial nerve is going to pass through it? Well, cranial nerve number 2. I'm trying to go in order for you guys. It is called the optic nerve. And again, this is another special sense. This is carrying information of the retina of the eye, right? So that is specifically visual information. All right, next, this hole is kind of wild. Because it's not round, it's actually just kind of a little slit underneath the lesser wings. Okay, so right here, and I'll show you from another perspective, but right here is what I'm talking about, right underneath the lesser wings. Okay, this is called the superior orbital fissure. Okay, so sometimes abbreviated SOF. Okay. Again, it's not like a round hole, it's a slit. Okay. There are actually 3 different cranial nerves that pass through this fissure. Okay. So the first one is cranial nerve number 3, which is called the oculomotor. An oculomotor should imply to you that it has something to do with oculo, which is eye, motor, which is movement. And so most of the eye muscles, which you're going to learn about in a future lesson, are controlled by cranial nerve number 3, the oculomotor nerve. Cranial nerve number 4 is also going to pass through the superior orbital fissure, and this is called the trochlear nerve. Okay, and as you're going to see when we look at the eye muscles, one muscle is going to pass through a trochlea, through a little hourglass thing. And so that particular muscle is called the superior oblique. The superior oblique is controlled by cranial nerve number 4. Right, and that's why cranial nerve number 4 is called the trochlear, because this particular muscle that it controls passes through a trochlea. Okay. Finally, one particular part of cranial nerve number 5 is going to pass through the superior orbital fissure. Okay. This nerve is called the trigeminal nerve. And so tri implies that there are actually 3 different branches of this nerve. Only one of those branches is going to pass through the SOF. Okay. And when it does, it is going to control so it is called the ophthalmic branch. Right, so just more eye control. Okay, and that's all we need to know for this class. Finally, the abducens. Oops. Cranial nerve number 6. The abducens nerve is going to control the lateral rectus muscle, right? So only one of the eye muscles. I'm going to go back to the trigeminal ophthalmic branch is also going to control the skin of the forehead. All right, so there's a lot more detail in your textbook that is going to elaborate on these different cranial nerves, but this again is really what you need to be studying for the lecture exam. I want to give you a little bit more perspective on the SOF and where that actually is. So here we see the skull from the anterior perspective. I want to point out that this little hole here is the optic canal. Right, so the eye would be here in the orbit, and so the optic nerve is going to pass out medially and posteriorly to the eye, pass through this whole crossover at the optic chiasm, you'll get there, and then ultimately carry information all the way back to the occipital lobe here. The SOF is not a foramen, it's a fissure, right? So it is this little slit right here. So this is the SOF. All right, getting back over here, we left off talking about the SOF, which has part or entirely cranial nerves 3 through 6 passing through it. I want to now talk about the 3 other holes within the sphenoid bone itself. So again, this is the optic canal. The next hole to talk about here is this one. Right, so this happens to be the foramen rotundum. So the foramen rotundum has another part of the trigeminal nerve passing through it. So this is cranial nerve 5, but oops, sorry about that. Cranial nerve 5, but the second branch. And so this again is the trigeminal nerve. But this is the maxillary branch of the trigeminal nerve. And so maxillary implies that this has something to do with the upper jaw. Okay? And so specifically the second branch of the trigeminal nerve is going to control the lower eyelid. We're still using the same format of this table that I started on the previous slides. Okay? It is going to control sensory and motor, the superior lips and gums, as well as the palate. All right, so pretty much all of these structures are associated with, or actually part of, the maxilla bone. So that is the foramen rotundum. The next hole I want to point out is right next door to the foramen rotundum, and that is this oval hole right here. And so that oval shape is what gives this hole its name. Foramen, it's a hole. What is the shape? Ovale, foramen ovale. Through the foramen ovale, the third and final branch of the trigeminal nerve is going to pass. This one is called the mandibular. All right, so the second branch was responsible for controlling and sensing things going on within, sorry about that. Within the mandible, so within the upper jaw. But this one, the mandibular branch of the trigeminal nerve, this one is going to be responsible for sensing the inferior gums, okay, the tongue, okay, and it is responsible for motor control of muscles of mastication. Okay, so mastication, so chewing muscles. The final hole that is actually passing through the sphenoid bone is this one right here. And on this diagram, it kind of looks like it's off to the edge of the sphenoid, but in fact, it's actually passing straight through the sphenoid bone. This hole, again, is a foramen, and it's called the spinosum, foramen spinosum. This hole does not have any cranial nerves passing through it. Okay, this one's just for blood vessels and such. So important for you to know, but there are no cranial nerves. So I do want to point out that I introduce these holes to you in this order, right? Starting anteriorly and moving laterally and posteriorly, ROS. Right? So ROS is the order of these holes. And of course, the O for ovale, nice middle one, oval in shape. And so it's somewhat easy to recognize that. Okay. The next hole I want to point out isn't a hole that passes specifically through one solid bone. Instead, this is a gap between three bones. And so it's a little bit, difficult to imagine, right? Because it's negative space. And so this gap right here between the pink temporal bone, the orange sphenoid bone, and the blue occipital bone, this is the hole that we're talking about. It looks really jagged, and definitely take note of this when you look at the models for the lab. But this jagged bone looks lacerated, right? So a laceration is a jagged cut. And so this one is called the foramen lacerum. And just like the spinosum, foramen lacerum does not have any cranial nerves passing through it, but you should be aware of this hole for both the lecture and the lab. Next. All right, the next hole that we have is this one right here. Okay. Note that the pink bone is the temporal bone, and there is a ridge right here. This is actually a fairly thick portion of the bone, and it's hollow. Inside this hollow portion of the bone is where all of those different structures associated with hearing as well as with balance are located. So the semicircular canals, the cochlea, the auditory ossicles, those tiny little bones you guys learned about, all of that stuff is located here, nice big prominent ridge. And so this hole is essentially coming straight out of this big prominent ridge, which is right, or which encases all of the equilibrium and hearing structures. Keep in mind that the opening to your ear canal would be like over here. Okay, so essentially, right, you hear in here, lots of funny stuff happens in here, and then ultimately the nerve associated with hearing and with balance has to exit this bony space within the temporal bone and enter into the cranial vault and inform the brain about what you're actually hearing and information about where your body's positioned. And so these two holes are in line. Right, they both have something to do with acoustic something, right, hearing. And so we call this one, as promised, the internal acoustic meatus. And I told you that if there is an external, there's probably going to be an internal as well. And that is absolutely the case. Okay, so that is called the internal acoustic meatus. The nerve are actually two different nerves that pass through this hole. First of all, we have the facial nerve, which is cranial nerve number 7, facial nerve. And this one is responsible for a lot of different things. Essentially, once the facial nerve passes through this hole, it branches into 5 different branches. We're not learning those 5 branches, but essentially, if you put your hand on your face like this, the 5 branches of the facial nerve are essentially going to these places. And so the facial nerve is essentially responsible for making facial expressions. Right? So controlling muscles of the face is a really important job of the facial nerve, as well as relaying taste, or more specifically, gustatory information. Okay. The second and final nerve that passes through the internal acoustic meatus is one that you have seen before. This is cranial nerve number 8. The vestibulocochlear nerve. Right, so the vestibule is essentially the space in between the cochlea and the semicircular canals. The cochlea, of course, is what houses all of those organs of Corti, all of those spiral organs that are actually detecting the movements created by sound waves and then converting them into an electrical signal to be relayed to the brain via what? Via cranial nerve number 8. And so vestibulocochlear is taking the vestibular, semicircular canal, and cochlear, hearing information to the brain. So this is carrying auditory and equilibrium data, or more specifically, body position, so proprioception information. Okay. All right, moving right along here. The next hole is this one right here. Okay, so this is a little bit tricky because right, the skull is a 3-dimensional shape, and so in order to see this hole, generally you have to kind of turn the skull to the side and look at it laterally, just because yeah, it's covered a little bit by the temporal bone. This diagram actually does a pretty good job, I think, of showing you this hole. So I chose it. And so this hole is called the jugular foramen. All right, so you may have heard of the jugulars before. What are the jugulars? The jugulars are veins that are essentially draining the overwhelming majority of deoxygenated blood out of your brain. So all of that blood that was just used to fuel your brain's functions, to create cerebrospinal fluid and lots of stuff, that is all going to drain out your jugular foramina in the jugular veins. In addition to the jugular veins, a couple cranial nerves are going to pass through the jugular foramen. First of all, we have cranial nerve number 10, and this is one that you're going to learn all about on AMP2. This is the vagus nerve, and this is really the oddball out in terms of cranial nerves. All of the rest of the cranial nerves are going to be sensing and controlling the motor function, or both, of the face, of the head, of the neck a little bit, okay? So all this stuff in the head, the vagus nerve does not. Right? There's a little bit of a function within the head and the neck, but for the most part, the vagus nerve is going to travel all the way down to your thoracic, into your abdominal, all the way down into your pelvic cavity, and is going to control the parasympathetic function of your visceral organs. All right, so let me clarify this here. Essentially, this is going to stimulate things like the digestive tract. Right? It is going to suppress the cardiovascular system, right, etc. So essentially, it is controlling the parasympathetic nervous system. Okay, so about 75% of the parasympathetic nervous system's functions are controlled by or enacted by this one single nerve. Second and final nerve passing through this hole, cranial nerve number 11, and this is the accessory. Okay, so the accessory nerve is going to control accessory structures, so things like the palate, the pharynx, another word for your throat, larynx, your voice box, and certain muscles that are, pretty much accessory to the head. So they're not actually on the head themselves, but they are helping to move the head. And so the things like the sternocleidomastoid muscle, as well as the trapezius, or at least the superior body of the trapezius, are controlled by this cranial nerve. So that's the jugular. There is one more hole to mention right now. And that's the last one that we're going to talk about. And that hole is right here. Note that it is actually part of the wall of the foramen magnum. Okay, so this big hole where the spinal cord travels out, these holes are in the lateral walls of the foramen magnum. All right, this is called the hypoglossal canal. And as you're going to see, the term or the root glossus means tongue. Okay, so this one is under the tongue canal. And so, your tongue isn't way in the back of your skull. What's going on here? Well, cranial nerve number 12, which is the final cranial nerve, passes through this hole, and it is called the hypoglossal nerve. Okay. What exactly does the hypoglossal nerve do? Well, essentially, oops, I forgot cranial nerve number 9, didn't I? Sorry, I will go back in just a moment. The hypoglossal canal under the tongue, hypoglossal nerve, is going to control the tongue movements, right? And as we're going to see, the tongue is made up of muscles that are mostly like down here in your mandible. And so this nerve passes under the mandible in order to get to the tongue muscles to control them. Okay, so going back to the jugular foramen, I did neglect to mention one nerve that passes through, and that is cranial nerve number 9. This is called the glosso, right, the tongue pharyngeal nerve. Okay, so glosso means tongue, pharyngeal, something to do with the pharynx or the throat. So what this nerve does is it's going to control the posterior tongue and part of the pharynx, okay, part of the throat. Okay, so sorry about that. 3 nerves pass through the jugular foramen, 9, 10, and 11. Okay, so again, for the lab, I will point to a hole and I will say, what is this hole? Okay. For the lecture, I might say, what is this hole, or what is the nerve that passes through it, or what is this nerve responsible for doing? So definitely spend a lot of time with this diagram here. And this might help you. There's a lot of different devices that you can find online for remembering all of these cranial nerves. And so here is 1 through 12, and they've drawn in the numbers where essentially those nerves are going to act, and little devices for remembering what order they come in. All right, whatever works for you, go with it. Okay. I do want to elaborate just a little bit more on another perspective on a mid-sagittal section through the skull. All right. Things we already know, right? Actually, we know all of these already, but just for some perspective, frontal bone, parietal bone, occipital bone, temporal bone, mandible. Right, we can actually see a new structure here in the mandible that I want to point out. Note that there's a little like Y shape right here. This is actually a hole right at the joint of this Y. The hole is a hole in the mandible, so we'll call it the mandibular foramen. And essentially, this is how we get blood to the bone of the mandible, right? So arteries and veins will pass through this hole and feed this living bony tissue within the mandible. Remember that there are other holes on the chin, so those are also in the mandible, but those are called the mental foramina. Okay. All right, this, right, where these little lines are pointing to, this is the ethmoid bone. Okay. Note that this structure up here is the crista galli, and this structure down here is the perpendicular plate. This funny shaped little green bone right here is making up the inferior half of the nasal septum, and that would therefore be the vomer. Okay. Note that the maxilla is here in purple, and a new structure on the maxilla that we have not yet seen before is this right here, right? So essentially, if you run your tongue along the roof of your mouth, right behind your front teeth are those little ridges that you can feel. Those ridges are right over this particular structure. Okay, and so the part of the maxilla that makes up the anterior portion of the hard palate, so the bony roof of your mouth, this is called the palatine process, right? Because it makes up the hard palate. Okay, a new bone that we haven't seen before is this here, actually a pair of bones. So if you continue to run your tongue farther and farther back, like way in the back of your mouth, it gets a little bit squishy. That's called your soft palate. That is muscular, and it helps to make sure that your spaghetti goes down your throat and not out your nose when you're talking and trying to swallow at the same time. Right anterior to that squishy part in the back is another bone, and it's the last bones that we are going to be learning about. This is called the palatine bone. So conveniently enough, I think. Okay. These arrows here are pointing to the sphenoid bone. Okay, what can we see in the sphenoid bone? Well, these are the greater wings all the way out in the temple. Okay, while we're looking from this perspective, look at how the greater wings of the sphenoid bone articulate with the frontal bone, the parietal bone, and the temporal bone. And so this this section right here is your temple, and the reason why it's so dangerous to get hit in the temple is because there are so many skinny, thin little bones that are articulating together all in the same spot, that it makes this area a lot weaker than the solid bones of the rest of your skull. So your temples are fragile because so many bones are coming together in the same spot. Okay. Other things that we can see, here is a nice little Turkish saddle, all right? This is the sella turcica here. Okay, and here we can actually see that it's actually a cup shape. Finally, the sphenoid bone has these little extensions that stick straight down, and of course muscles attach and allow us to do funny things with our jaw. Those are the pterygoid processes. So that is all for that perspective. Okay, a couple other things that I want to clarify for you. When we take a section through the skull, all right, so essentially we're making a frontal or coronal section. What we can see is the nasal cavity. Okay, so this is the nasal cavity. Superior, middle, and inferior conchae are going to protrude medially into the nasal cavity. As you may remember from the special senses lesson, these nasal conchae essentially allow the inhaled air to be swirled around, flinging particulate matter to the sides of the nasal cavity to be trapped in that mucus and essentially digested, you know, and informing our immune system of what we are actually breathing in so we can protect ourselves. Also, these nasal conchae help odorant molecules, right, rose molecules, bacon molecules to fling to the sides, bind to those olfactory neurons, and ultimately inform our brain that we are stopping to smell the roses or bacon is cooking and we should be excited. Okay. So that is that. Note how the nasal cavity is just over the roof of the mouth. Okay. From a mid-sagittal section, we can see superior, middle, and inferior nasal conchae. So they just look like little ridges, but in reality, they are rather swirled, kind of like a conch shell, to agitate the air that we're inhaling. Okay. Also, I want to point out this orange bone up here. This is the sphenoid bone, and the reason I added this animation is so that you can actually see just how the sphenoid bone fits into the rest of the skull. Okay. Final thing I want to point out is that when we take a section through the maxilla, as we've done here, or well, this is the orbit, through the frontal bone, through the maxilla, there are essentially these big open spaces within your skull. And so these are called sinuses, and we've all heard of sinuses before because of when they are super annoying and uncomfortable and clogged with mucus and just downright gross. Ultimately, there are sinuses, these big gaps in our bones, within 4 of the bones of our skull. Essentially, these are interconnected, and so you can actually have contents from one go into another bone, etc. And I'm sure we've all experienced that before. So what really is the point of these sinuses? Why do we have them? They're just so annoying and they get clogged up, especially with all of the pollen coming out these days. So sinuses do a couple things. First of all, they lighten our skull. So in general, our heads are about 10 pounds, right? So like a 10-pound bowling ball sitting on your spine all the time. This is actually lighter than it would be if we did not have these big cavernous spaces. So instead of a 10-pound bowling ball, we might have a 15-pound bowling ball if our bones were more solid. So this reduces the amount of energy it takes to just keep our heads up. Okay. Also, these sinuses do a lot more than just lighten the skull. They are lined with mucoses, so the same kind of tissue that is lining our nasal cavity. And more or less, the sinuses help to humidify the air as it is being inhaled into your lungs, and this makes our lungs happy, and respiration is easier when the air has a lot of moisture within it. Also, this helps to resonate our voices to be, you know, what we would expect. So, for example, when you have a stuffy nose, right, when your sinuses are all clogged, you sound very nasally. Your voice is entirely different than if these sinuses were more open. And so more characteristic voice resonance is only possible because of these sinuses. Now, why do we get a stuffy nose? Why do we get these clogged sinuses? Well, essentially, this mucous membrane can be triggered to produce a lot more mucus by our immune system. And so essentially the virus or bacteria itself can trigger this response, or we can trigger this response to try to protect our body. The thought behind this is that, or behind our own response, is that if there's more mucus, then there's less of a chance of these invading organisms actually getting down into our lungs and infecting our body. Instead, when we breathe in, the bacteria get stuck in this gooey mucus, and then we can eliminate that appropriately. We can blow our nose, or we can have the mucus drain down our pharynx and ultimately into our stomach, which of course kills anything that we ingest. So our immune system very much uses this mucus to protect ourselves. But of course, organisms have been co-evolving with us for a very long time, and so they have learned to hijack this system, making us a big snotty mess. And so if that is the case, and we're always wiping our nose and sneezing all over the place, then essentially these viruses, these bacteria can live within those particulates, which I'm sure we very much appreciate at this point in life, but they can live within those little droplets, mucus and water alike. And then when you sneeze, when you wipe your hands, when you touch things, they are therefore spreading themselves to a new unfortunate host. So that is just a teeny bit about sinuses for you guys. Final bone is the hyoid bone. As I said before, the hyoid bone is the one bone that does not articulate with any other within the human body. Students in the past have said it looks like a baby mandible, like especially when we're in the lab itself. And it really does look like this little U-shaped bone, but in fact, it is part of the larynx here. In a mid-sagittal section, we can see the hyoid bone here. Here's the epiglottis, the open airway down into your lungs. Here are your vocal cords. So here is where the hyoid bone would be located. Okay. And that is all for now. In a future lesson, we're going to talk about the head muscles and essentially how they connect to these different bones. If you want to prepare a little bit ahead of time, you can look up muscle terminology. I've shown you something like this before. We looked at things like rectus and transverse before. Now we are interested in nuchal. We are interested in ocular or orus, right? Orbicularis is a shape that we're going to see. So circular muscles, different muscles are named according to their function. So the buccinator or buccinator would be like a muscle that that a trumpet player would use to keep their cheeks in, to keep it from popping out. And so on and so forth. So thank you very much for watching, and I will see you in our next class together.